Hello once again. I'm Dr. Shad Diamond. I am the founder of the Holistic Research Institute and the developer of the Quantum Sensory Healing CDs. This time the topic is on health and disease, and I have a lot of information to share with you. I'd like to start off by doing a little bit of a comparison between the mainstream approach to medicine and some of the alternative healthcare approaches. Did you know that before the establishment of the AMA, the American Medical Association, that most of the doctors in this country were homeopathic? And initially, the word quackery was used to describe the allopathic approach to medicine, which is what today's mainstream is, where you use pharmaceuticals more so than you do natural approaches to things. Now, more and more people, including some doctors, are starting to realize that allopathic medicine is rationalized medicine because it's based on double-blind studies that assume a single cause for a single illness, which is not the way the real world works. When you look at alternative healthcare and how it's done, it's experiential and therefore practical because it's about what you observe and then using what works. You compare that to mainstream, the approach that's used in allopathic medicine is unreasonable. Why? Because their conclusions are constantly changing. One day they say something works, the next day they say it doesn't. Oh, by the way, it might even be dangerous. We've come up with a new way. Now, a lot of that is actually a manipulation in order to sell new drugs. But we'll get into that a little bit later. Now, there's another reason why you can have inconsistent test results in mainstream, and that would be that they don't take the consciousness factor into effect. In other words, a double-blind study can't really prove anything when the individual's belief in the treatment affects the outcome. In other words, it's the consciousness of each participant that decides if they're going to allow the body to heal itself or not. And I said that in a very specific way, which we'll be talking about later. So sometimes the inert pill does work and the active pill does not. And so the placebo effect takes place on both sides of the fence. In other words, the mind can override the real drug just like it can believe in the sugar pill. Now, pharmaceuticals are designed to inhibit a process in the body in order to address a symptom or to relieve a symptom. They don't actually fix anything. Pharmaceuticals don't address the actual problem. Now, I'm not a medical doctor, I'm a PhD. So I'm not a medical doctor. That's good because I can say whatever I want to and not have my license pulled, my license to practice, because of my opinion. So I do want to do a little bit of a disclaimer, however, because mainstream medicine is not all bad. In fact, there's a lot of good in mainstream medicine, and they deserve the respect for the useful knowledge that they hold. Unfortunately, a lot of the research is driven by profits for special interest groups. The industry is aimed at dependency rather than cures.